Naloxone, commonly known as Narcan, is an over-the-counter treatment that can save a life in an opioid emergency. In this episode of Being Well, I'll speak with Horizon Health's Sean Robison and Adam Webb about how someone goes about getting and giving this life-saving treatment.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for another episode of Being Well. I'm your host, Lacey Spence, and today we are talking about a potentially life-saving topic. We are talking about naloxone use, and joining us to have this discussion today, we've got two guests coming all the way from Horizon Health. Today we've got Sean Robison and we've got Adam Webb. Welcome to Being Well.
Thank you for having us. Thanks.
And welcome back. Good to see you again, Sean.
Thank you.
For folks who maybe didn't get to meet you in prior episodes, can you give a little introduction to your title and what you do at Horizon Health?
Sure. I currently do EMS education, so I'm in charge of community education within our community area, doing CPR classes and EMT classes and things of that nature.
Mm-hmm. Mm-hmm. And you drew the lucky straw of getting to be here today to educate us.
Yes, ma'am. It's great.
Wonderful. And then we also have Adam, new guest to the show. Can you give us a little bit of background about where you're from, how you got to doing what you're doing?
Well, again, thank you for having us. Yeah. My name is Adam Webb. I am the EMS manager for Horizon Health. I grew up in Paris. I've worked as a paramedic going on 18 years now. So I've had experience both in ground ambulance as well as helicopter. So vast experience, but now I'm in a management role, so I get to oversee the operation day to day.
Wonderful. So as we move into our topic today, we're going to be talking about naloxone use, maybe more commonly known as Narcan, but a life-saving drug. To back up, this is used for treatment, emergency treatment for opioid overdose. So for people who aren't aware, what is an opioid?
So an opioid is a drug class that acts on opioid receptors throughout the body that help blunt the pain response. This can be prescription drugs such as morphine, oxycodone, hydrocodone, Demerol, and fentanyl. Then on the illegal side, you have your heroin. So those are common opioids.
Mm-hmm. And so what type of effect do opioids have on the body?
Sean?
Basically, it's to kind of go off Adam here, they do block those pain receptors, and they on the illegal side of things, they do provide that victim with a euphoric type feeling, and can be used in that particular manner.
Gotcha. So if somebody has overdosed, then what are some common things that people can look for?
So when someone overdoses, the most common symptom is going to be the unresponsiveness or semi-consciousness. We're looking for respiratory depression. Is that person breathing? Their fingertips or lips may be blue. They could have a slower pulse rate. But those are the common things to look at for someone who has overdosed. A lot of people look at the pupils as well. And if the black part of the eye, if that's what we call pinpoint, very small, that's a good indicator that they have overdosed.
Very small when you're not under bright light.
Right.
Yeah. I know that we have mentioned both sides of things, medicinal and then also illegal. Is it easy for someone to overdose?
It depends on the person. Some people are very used to taking opiates. Maybe they're a chronic pain patient and take those for a long time. But the things we usually see the overdoses in are these illegal street drugs that they're cutting these drugs with fentanyl and other opiates that these addicts may not realize that their drugs have been cut with, so they take their normal dose or maybe more than the normal dose, not realizing it's cut with these opioids, and that's what causes the overdose.
Mm-hmm. And so as we are talking about this life-saving tool here, if somebody does not have Naloxone or Narcan, what are the steps that someone can take to get it?
You can normally reach out to like your local health department, and some hospitals are going to a dispenser route outside of their facility. Some places really just depends. You can walk in and get it, like community-based organizations and things of that nature. So it's really just about calling around, seeing where you can get it.
Mm-hmm. I can speak for Horizon. At the hospital, we actually have it available in our ER waiting room as well as at our Life Center. But as Sean alluded to, it's becoming more and more prevalent. You can get Narcan almost anywhere anymore. Lots of local businesses are participating, seeing how important it is to have Narcan available in the community. So if, like he said, if you're unaware of where to get it, you can probably call your local health department. They can point you in the right direction.
Sure. Health department, pharmacy, sometimes our government representatives. I know some police stations or city halls have them. If I'm somebody who needs this life-saving drug, if it's so readily available, that means I don't need a prescription for it, correct?
That is correct. This Narcan you had to have a prescription for, but as the opioid epidemic has increased, there has been they figured out that the more people we can get Narcan in the hands of, the better. So they have made that a non-prescription medication.
Mm-hmm. And so I think it's probably important to get the message across that if somebody is going through this, is experiencing overdose or thinks they might be at risk, how important is it to assure them that help is here, you're not going to get in trouble like this, is to help save your life?
Yeah.
Yeah, we always, respond to those kinds of people in a judgment-free zone, and trying to get them to help that they need is uber important for us to not only administer the Narcan and allow them to have that, but to get them the resources that they might need to get better.
Mm-hmm. On the opposite side of maybe going through a rescue event, can that be maybe drug counseling resources or things of that nature?
Sure.
One thing we do at Horizon is if we have these overdose patients, if we get called out for an overdose, mm-hmm. we'll treat the patient, of course, but we actually leave them with resources of drug treatment. We leave them with a dose of Narcan to follow up. But the big thing is we leave them with a folder that contains resources should they want to get help.
Wonderful. Yes. Knowledge is power. So leaving that in their hands for when they are ready, I'm sure has to be incredibly maybe empowering that there's hope on the other side of this. So our conversation today, as we're talking about Naloxone use, Narcan use, Sean, we see it with you there.
Yes.
So if we could just kind of talk about, for demonstration purposes, how it's used, how you administer it, take it away.
First thing is we want to make sure that what the Narcan you get is not expired, which hopefully if you're getting it from an outlet, it's not.
Sure.
But expiration date can be found anywhere on the box. This is usually the most common form that we see for people being able to get. You're going to open that up however you need to, really. Mm-hmm. And inside, there's normally multiple doses in here, and this one carries 2. This goes intranasally, which means it goes into the nose. So if you come across a victim who is in need of it, you're going to take it out of the packaging we see here and stick this long white prong up the nose and just push the bottom like a syringe.
The red part.
Yes, the red part, and it'll go up into the nose where it belongs. They give you 2 because some of the street drugs we are seeing are a little bit more powerful, especially if they're using the fentanyl, so you might need to actually use 2 doses. If the individual gives the first dose and they don't see a result in 2 to 3 minutes, go ahead and administer the other one.
Mm-hmm. If I'm somebody who's in the middle of using this, do you recommend me calling 911 as I'm administering it, or do I need that kind of guidance?
First of all, if you come up on somebody who might be in the need of this, 911 should be your first course of action.
Okay.
Calling them, you can put them on speakerphone, talk to them. They'll probably help you walk through the process, especially if you tell them you have Narcan and you believe this person might be overdosed. They can walk you through that process and definitely get EMS on the way.
Mm-hmm. And obviously, you giving the demonstration, this is for purposes if I already have the Narcan. If I don't have it available readily, that's something that you all carry on the ambulance, correct?
Correct.
Of course.
And after this is administered, like you said, waiting a couple minutes to see if they're doing okay, would that be watching for like they're regaining consciousness, or do I need to be like checking their heart rate? What's kind of next?
Basically, once you get this, it takes a couple minutes to take effect inside the body. A risk that you could see is somebody coming back to and being a little out of control, maybe a little, depends on what kind of drug and how much they've taken. So that is a small risk that you could see in giving that. Mm-hmm. But other than that, if you don't have it handy with you or you're waiting on it, just monitor that person, get 911 called, and just kind of watch them.
Yeah.
So things you can do in the meantime if you don't have Narcan is to roll that patient onto the left side, so in case they do vomit, they don't, what we call aspirate or choke on that. Monitor their breathing. If you're comfortable checking for a pulse, you can do that. And if they are not breathing and don't have a pulse, then you can start CPR in the meantime.
And so what if you give it and it's actually not needed? Maybe they're not actually having an overdose.
So the good thing is Narcan only works on opioids.
Okay.
So if the patient does not have opioids on board, it is kind of like squirting water up their nose. It's not going to hurt anything. There is no adverse reaction, so it only works on that one instance.
So that's what the chemical is, and it's just targeted for that opioid.
It is, yeah. So I talked about the receptor sites in the body. So imagine a table with 5 seats at it. When someone takes an opioid, the opioid sits at all those seats. When we give Narcan, it essentially kicks all those people out of those seats and opens that receptor site back up.
Gotcha. So as we're having this conversation and the time that you all have been in emergency care, have you noticed an increase in need for Narcan in our area?
100%. 100%.
Yeah.
And it does come in waves. It definitely has increased in prevalence over the years. We use the term bad batch. I won't say there's a good batch, but we usually know if we have an overdose call, and there's usually going to be a group of them because there is a batch of drugs going around that is most likely laced with an opioid. So those overdose calls do usually come in waves.
Mm-hmm. Is there maybe a time of year that you notice an increase in calls either? There might not be,
Yeah.
but I was just curious. A lot of times I feel like people maybe talk about around the holidays or...
There are certain occasions. I won't say it's one time is busier than the other.
Sure.
But to your point, there most certainly can be. Any holidays are a big one, family get-togethers where maybe they're not seeing their family can cause some depression issues and increased drug use. But yeah, to your point, there's no certain time of year that's more prevalent, but it's pretty steady throughout the year.
Mm-hmm. Is there a case or two that either of you can recall that maybe Narcan has played a huge role in helping somebody?
Absolutely.
Without going into too much detail, usually if we can get there in a timely fashion after they've taken the drug, Narcan is very successful getting that individual back. There are cases in which Narcan does not and is not very successful, but those are kind of few and far between. We're usually pretty good about getting Narcan as readily available as it's everywhere. So people are able to get it.
Yeah. Adam?
Well, nowadays, not only is EMS carrying Narcan, but also fire and police as well. So if fire and police beat us to the scene, they can go ahead and administer that. And like we said, it is a non-prescription. So families can give that as well. But we see overdoses at least probably once a week, once every couple of weeks. So it is something we go to relatively often. And more often than not, Narcan works is already in the system and working by the time we get there. I want to reiterate the fact that if someone does give Narcan, I am not a lawyer, I am not a police officer, but there is no legal ramification. That person does not get arrested for using a narcotic, and the family member that uses Narcan, they are completely covered under law. So always look out for your family members, patients, do what's best for them.
You need to be alive to be able to seek help and recover. So as we're talking about this topic, is there anything that I haven't asked that either of you think is really important for the viewers to know?
I can't think of anything. I think we've covered quite a bit today.
As it becomes more prevalent, we talk about, there was a big push here in the past couple of years about how prevalent fentanyl is, and if you get exposed to fentanyl, that you could overdose very easily. That kind of got overblown. It is definitely, if you ever think you've been exposed to fentanyl or any opioid for that fact, it is good to seek emergency care. But the prevalence of Narcan is becoming so much that it is a great thing. We're seeing less and less deaths due to overdoses because of the prevalence of Narcan. So I think you can't change human behavior, but we can put steps in to help everyone we can.
Absolutely. If I'm somebody who thinks I've maybe been exposed to fentanyl, what kind of symptoms am I presenting? What am I feeling?
So you can have some dizziness, lightheadedness, maybe some difficulty breathing, up until that point where I said you could start losing consciousness. If you ever feel like you've been exposed, please contact 911. If we get there and we deem that you are not in need of medical care, we will check you out and turn around and go home. That's not a problem for us. We're happy to see that you're okay, but even if we do administer Narcan, that patient does not have to go to the hospital if they are alert and oriented at that point. We hope they do go to the hospital, because Narcan, it does have what we call a half-life, an effective range of about 30 minutes. So if there is a lot of opioid in that system, we have reversed that for 30 minutes, but if there's enough left over, they can actually overdose.
Oh, wow.
So we like to see them go to the hospital to get checked out.
Yeah, I don't know if you can speak to it or not, but if I'm somebody who is experiencing that, do they give another dose of Narcan, or is there something further that they can do for me?
Oh, great question. So if your first dose of Narcan doesn't work, you can definitely give a second, third, fourth, or if they relapse, say after EMS leaves, then that process can be repeated all over again. We can give Narcan until the cows come home, so to speak. There is not a max dose, but if we're given more than probably 1 or 2 doses, we definitely need to be transported to the hospital for evaluation.
Yeah, and again, giving family members or loved ones, a peace of mind that they're not going to harm somebody by giving the Narcan, because I'm sure it's already a tense and scary situation.
Absolutely.
So we've covered this topic really well, but I would like to talk a little bit about your all's day-to-day, since community education is a big part of what you do. I know, Sean, we kind of talked about it last time you were here, about some basic care response demos. Again, just to reiterate, what type of educational opportunities are there for community members who are looking to maybe step up their first aid game?
We currently offer every other month free CPR classes for any community member. You do not have to live in Paris to come. I've had people come from Terre Haute, Indiana, all the way from over here, Charleston, Mattoon area, to come to those. We do offer some additional training on top of that for different first aid classes and things like that if they are requesting that. We offer like an EMT course if they want to actually go to a career route and learning how to save lives. We do offer some courses for a step down from that. So that's called first responder. So they can come in and get a 9-week certification course on how to provide most of that first aid, or maybe join a volunteer fire department, help their community, or maybe their factory does first responder stuff as well.
Yeah. And if I'm somebody who's going through maybe one of the CPR classes, can you kind of paint the picture of what attending a class looks like?
Sure. You come in and we spend about roughly 2 hours going through everything. I see people that have never even touched the equipment or been around that kind of environment. So we spend a nice long time going through all that to make sure that they're very comfortable going out the door to do any kind of CPR interventions in the general public.
Mm-hmm. Sean, correct me if I'm wrong, you do go over Narcan use in your CPR classes,
Yes,
correct?
yes, we do. We do go over the Narcan on how to use it.
Gotcha. Well, it sounds like you're really equipping people to have a lot of tools in their tool belt to help save somebody and help stabilize somebody. Since this is your first time here and you kind of talked a little bit about your day-to-day looking different these days, what does your role kind of look like as far as making sure EMS educators are doing their job and keeping the community up to date?
Sean's doing a fantastic job in his education role.
Yeah.
Right now, Sean is our sole EMS educator, teaches our CPR classes, our first responder classes, as well as our EMT classes, but my day-to-day focus is more on the operation of EMS, staffing ambulances and making sure the crews have what they need to provide care, the best care to the community.
Mm-hmm. And so let's go back a little bit. Again, obviously you can't use names or anything, but are you able to talk about a time where you responded to maybe one of these Narcan overdose situations, kind of what was going through your head, what was the surroundings like, if either of you want to start?
So anytime we respond to a call for a potential overdose, you're always thinking on the way of the call, what things you're going to do, what it could be, kind of mentally preparing for that call. But the last one we had was called out for unresponsive, not breathing. Well, in that case, it can be a multitude of things. When we roll up, police are already on scene, and they, like I said, police carry Narcan now. They had already given Narcan to this patient. Not something we would immediately thought of, but in that case, that is something the police had, and they are very, very active in giving Narcan. By the time we got there, not only was that patient breathing again, they were sitting up talking. Mm-hmm. So that just shows the importance of early Narcan administration from the get-go.
Yeah. Sean, does any case come to mind for you as well?
Not in particular. Over the years, I've dealt with that a lot, of dealing with overdoses. But it's pretty, can be pretty high stress because we're trying to do our best to get that individual back, especially when Narcan was not as prevalent as it is now. Things were a little bit worse per se that back then, because EMS or emergency services were about the only people that carried it. So getting there faster and administering that quicker was a major key point in getting these people back. But now it's much easier, much less stress in my mind anyways than it used to be.
And so we're in our last couple of minutes here. If somebody missed the top of the episode where we were actually giving the demonstration and getting people familiar with what Narcan is, what it looks like, Sean, do you mind running back through that just in case somebody missed it? Sure.
So this is your normal box of Narcan. Like I said before, there's usually 2 doses in here. You can use both. It's not going to hurt if your victim needs it. This goes intranasally or up the nose. You're just going to push that little red button on the bottom once you get it up the nostril, and it can go. And I don't think I said before, it doesn't matter which nostril you use. Mm-hmm. Everyone's got one nostril bigger than the other. So if you didn't know that, so if you're kind of looking there, if you want to go for the bigger nostril, it might work a little better, but I don't really see a big need to really make a big difference. If your victim does not start coming around with that first dose, you can use that second one.
And I'm sorry if it's an ignorant question, because I know you just said either nostril is fine, but if I have to administer multiple doses, should I swap nostrils? Is the same one fine?
You can, or you can use the same one. It doesn't matter.
Okay.
Yeah, there's no, it's fine.
If one doesn't work, you can always try the other.
Yeah.
Right. All right. Well, thank you so much to both of you, Adam and Sean, for coming to talk about this important topic. Hopefully it's illuminated, this important issue, and also help put some people at ease for being able to administer this on our own. So again, thank you so much for being here.
Thank you.
Yeah, thank you. You're very welcome.
The pleasure is ours, and thank you to our viewers for joining us for this episode of Being Well, and we hope to see you next time.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl With Health Alliance is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
Next time on Being Well.
Symptoms of GI health issues can range from annoying to causing discomfort. We're talking nausea, burping, bloating, frequent heartburn, and more. In this episode of Being Well, I'll sit down with Carl's Alicia Sledge to talk about ways to focus in on your digestive health and get it back in check.